256 Shades of Grey, a video explanation of common radiology problems. These podcasts are designed by a team of medical students, junior doctors, and our resident consultant radiologist, Dr. Dave Richardson, consultant at University Hospital, North Durham.
Here we have a 60-year-old lady who was an inpatient on the ward because of pneumonia. One night she got out of bed to go to the toilet, but unfortunately fell and banged her head on the base of the bed. The nurses found her on the floor. She was confused. The extra worry in this patient was she was currently taking warfarin for atrial fibrillation. In view of these findings, a CT head was requested. Here we have the CT showing asymmetry with a bright area on the left side of the patient laterally. It is associated with a soft tissue swelling outside the skull vault where she hit her head. No such similar changes are seen on the opposite side. Asymmetry is important when looking at radiological images. The other thing to notice is that the ventricles are very asymmetrical. Here we have a normal looking right lateral ventricle. The left ventricle is squashed. The sulci also worth looking at. We can see a reasonable amount of CSF around this patient's brain on the right, much less on the left. This is indicative of increased volume within the left hemisphere due to this bright high attenuation material. So what is this bright high attenuation material? As we can see, bone is very bright, CSF within the ventricles is dark, and the brain substance is mid-grey. Acute blood is very bright on a CT head. So this CT is very, very suggestive of an acute bleed here on the left side. Where is this blood? It has a biconvex appearance. In other words, the inner margin and the external margin of the hematoma are both convex. This suggests that it's tethered anteriorly and posteriorly, and it is tethered where the meninges attach to the skull vault. So this is an extradural bleed. Subdural bleeds spread where the internal surface is concave and the external surface is convex, because they are not tethered by the attachments of the meninges, the dura, to the skull vault. It is quite nice from a radiological perspective and a diagnostic perspective that the internal blood corresponds to the external soft tissue swelling, which will also be some blood. So what do we do now? We need to know whether this patient has fractured her skull. To do that, we need to change the window settings so we can see the brain in more detail. Here we can see a horizontal line through the skull vault where there is no horizontal line on the opposite side. Sometimes the sutures, which are here and here, can be confused with fractures, but when there is no symmetrical line on the opposite side, a skull fracture is highly likely, particularly when it corresponds with the area of high attenuation as a hematoma. So the learning points from this patient are: acute blood is white on a head CT, as opposed to more chronic blood, which is much darker in colour. Extradurals have this biconvex appearance, because they are limited by the attachments to the dura to the skull. Skull fractures should be looked for at the same point or the opposite side of the brain. Symmetry is very useful, showing the midline should be in the midline in a normal brain. The ventricles should be more or less symmetrical. The sulci also should be more or less symmetrical. So the absence of symmetry is an important factor when looking at a CT of the head, just like in many other radiological examinations.
This video podcast was produced by MediSense. You can find more creative ways to learn differently on our website www.medisense.org.uk.